Hello, my name is Melissa Silverberg, reporting for the RSNA Daily Bulletin. I'm here at RSNA 2019 with Dr. Jeffrey Klein, Dr. Seth Kligerman, and Dr. Mark Schiebler to discuss vaping-related lung injury and what radiologists should know about with this developing health crisis. Dr. Kligerman, what challenges do radiologists face in diagnosing vaping-associated lung injury?
I think first is just recognizing the different patterns of lung injury. It's something that really wasn't in the literature before a few months ago, and so people have to be current. They're reading about it in the lay press, but they really haven't seen the imaging manifestations. They have to be aware that the most common imaging manifestation is an organizing pneumonia pattern. And one thing that we're strikingly seeing with the organizing pneumonia pattern and also the diffuse alveolar damage pattern is striking sparing of the subpleural interstitium as well as the peribronchiovascular portions of the lung and around the heart as well. And just recognizing that, and even in patients, young patients especially, when you see someone coming in with a diffuse lung injury bilaterally, it could be just viral pneumonia. There's lots of causes of this pattern. It's not unique to vaping lung injury, but to be aware that just ask your clinicians, does the patient vape? A lot of people take smoking histories, but they don't take vaping histories. Just make them aware that this is a possible entity in this patient. Hey, this could be this. Ask them about vaping.
And what advice can radiologists give their clinical colleagues on vaping-related lung injury?
Just saying that I think they have to have them ask. When you see a pattern, if you see someone coming in with any form of acute lung injury, and especially when they're young patients, just tell your clinician saying, hey, have you taken a vaping history? Especially a lot of these people are young, they're young kids, they're 16-year-old, they're 17-year-olds. And I would tell them that maybe they want to take a history with the mom out of the room, because a lot of the kids may not be willing to say that they're smoking some form of marijuana oil or vaping nicotine in front of their parents, because these processes can be rapidly improved with steroids, and that's important to start that quickly if that is the underlying cause.
And what's the role of the radiologist in evaluating this possible vaping-related lung injury?
I think just suggesting the diagnosis. I think that, there's a lot of cases out there, and some of the imaging findings are nonspecific. Again, we talked about cases that patients have hemoptysis, patients with diffuse central lobular nodules. These findings, especially in a younger patient, teenager, 20-year-old, 30-year-old, just make your clinicians aware. It's a diagnosis of exclusion. You are not going to make the diagnosis as a radiologist because it takes clinical input. They have to exclude infection. They have to exclude rheumatologic abnormalities. It's your job to just say, this is possible. Did you think about them? Think about this possibility, and let them go from there.
And Dr. Schiebler, how can radiology advance research on vaping-associated lung injuries?
So I think there's a two-pronged approach. One is to study humans that have been vaping, to watch how the pulmonary function changes over time and how the lung function changes by imaging over time. I think the second is to generate some animal models that mimic this, and then you can start to do experiments on what components of the vaping liquid are causing this.
And Dr. Klein, how can radiologists stay on top of this fast-moving issue?
Well, I think the best way for radiologists to keep abreast of late-breaking news in their particular subspecialty is the way we sort of keep track of a number of different evolving medical issues. First off would be to keep track of the literature. The RSNA publishes Radiology and Radiology cardiothoracic imaging, which certainly are going to feature some of the research related to this particular epidemic, and so obviously radiologists can keep abreast of that information. Obviously, looking at some of the other media communications that the RSNA puts out that may touch on this on a regular basis, and obviously through social media to learn more about what other people around the country, around the world are experiencing as regards this particular epidemic.
Well, thank you, doctors. This has been Melissa Silverberg reporting for RSNA Daily Bulletin. You can find more RSNA 2019 news at meeting.rsna.org/dailybulletin and follow us all year at rsna.org/news.